My name is Ryan Down. I am a pharmacy student, and today I will be talking about monkeypox. So, what is it? It is caused by the monkeypox virus, and it is a orthopox virus. It's the same. It's in the same family as smallpox, but not the same as smallpox. It was first discovered in 1958. There was an outbreak in a colony of monkeys that were currently being followed, and they're in research. And the actual source of the infection remains unknown. First cases in humans were in 1970, and then up until the current situation, all the previous cases of monkeypox was either linked to travel to Africa or individuals that were living in African countries at the time. And what the rash actually looks like, or how it kind of presents the rash, as you can see in the photo, it starts as red bumps and then goes into blisters, which then turns into open sores, and then the body starts the healing process. How it's spread is spread through direct contact, so touching individuals or being in close vicinities as individuals that have the active infection, fabric or surfaces with the virus, and there's still studies going on about how long it actually stays on the fabric or surfaces, and then sexual activity as well. Can be spread from the time of the rash until it is healed, and then can spread from mother to fetus, so pregnant patients can transfer this through the placenta. And since it is so new, they are currently studying if it's spread in asymptomatic patients, respiratory droplets, or actual bodily fluids, not this direct contact with the rashes or people infected. And anyone can get it, and so far what I can tell is that it's not easily spread, and it is still somewhat rare. So high risk individuals are people who come in contact with confirmed infected patients, having multiple sexual partners in an area that is known to have multiple cases or higher amounts of infected individuals with monkeypox. Healthcare workers, so those who are testing for monkeypox or handling blood samples, and then immunocompromised people also have higher risk. So the signs and symptoms, as I mentioned, that rash, that photo, but along with that, there are flu-like symptoms. So fever, headache, muscle and backache, swollen lymph nodes, chills, exhaustion, and the rash goes through, as I mentioned before, the different stages. So the exposed skin, and then scabbing, and then go through the healing process. So the lifespan of the infection, symptoms begin to appear 1 to 4 days after exposure, and then illness can last anywhere from 2 to 4 weeks before the resolution of the sores. When you should seek medical attention is having feeling sick with fever, aches, or swollen lymph nodes. If a new rash or sore appears, especially around the genitalia area, seek medical attention. And then if you come in close contact with a known infected individual. Prevention for this, obviously avoiding contact with individuals that are positive for this virus, or with unexplained rashes or other symptoms that I've mentioned. Practicing safe sexual techniques. There are vaccinations, one approved vaccination, which I'll mention on the next slide, and then obviously hand washing. So treatment for this, there is the vaccines at the bottom, but there is one medication. It is off-label use, and that's TPOXX. Its mechanism of action is it inhibits the activity of the orthopox virus, VP37 protein and blocks the interaction with cellular Rab9 GTPase and CIP47, which prevents formation of the enveloped virons. And then, as mentioned, it's the off-label, and below you can see the dosages for IV, and it also is oral. And those doses are weight-based. And for the vaccinations, Jynneos is labeled for prevention of monkeypox and is off-label used for post-exposure prophylaxis. So if you come in contact with a known infected individual, this vaccination can be used to try to prevent you from acquiring that the infection. And it is a live vaccine. It elicits the humoral and immune responses to the orthopox virus. And then the vaccinia neutralizing antibody responses in the humans, and they do have effectiveness for Jynneos. The ACAM 2000, it is a scarification only administration technique. So that's where the skin is repeatedly scratched with the needle before a solution of the vaccine is applied. So after 15 to 20 seconds of doing this, you should see some blood become exposed, and if there's no trace of blood is visible, an additional 3 insertions should be made using the same needle without reinserting the needle into the vaccine bottle. So questions, obviously it is a new infection, or newer with the amounts of infection that we're seeing, and there's constantly going to be more studies coming out. So, and references.